Also got Mr. Velumani joining us, Chairman, CEO and MD at Thyrocare. Mr. Velumani, good to have you with us this morning. We're trying to keep track of the fast-moving developments in the space. We've now heard that you're going to be kick-starting tests for the virus today. If you could talk us through that, what the cost is going to be, what the process is. Can people simply walk in, and what's the kind of numbers you're expecting?
Right. We are ready, but there are challenges. Challenges are the personal protective equipments are not available adequately, and it is a 7 days waiting period, I am told. Otherwise, we are intending to, our laboratory is doing tests today, and the rates, as government has fixed it, the rate would remain that, and if possible, we will subsidize it. But as on today, it is not the cost of reagent and cost of testing, it is the cost of personal protective equipments, consumables, all are in short supply. Whether they have hoarded it or they are unable to make it, it is not very clear. There are challenges in getting them. Having said that, government has not recommended anybody to walk in. Government says it should be recommended by a physician. And obviously, we are very focused towards delivering solution to needs of Mumbai, because Mumbai has 3,000-4,000 cases pending, I am told. So we will be today actively start with the Mumbai government business, where government doesn't seem to be having today a capability to handle it, though there are some government labs. So we are highly focused towards the needs of the Mumbai city. Also, please note, closing down everything, locking down everything is completely jeopardizing logistics. And without logistics in place, this kind of emergency cannot be handled. I wonder how government has planned to help the emergency and essential services logistics to be intact. Staff cannot move, staff could not come to office for the last couple of days. So we are facing challenges from staff side, consumable side, and of course, test is ready and we will be starting today.
Great. I agree with you, Mr. Velumani. That's what we're hearing elsewhere as well. But it looks like this week we're definitely going to be facing some of those challenges. Let's talk about the samples that you're collecting for tests in Mumbai. How are you choosing, in the sense, are these ad hoc samples that you're collecting? Are these, just give me a sense of, are these people listed as having symptoms? Are you going in for ad hoc samples? How is the process working?
I think we will not be deciding whom to test. It's the government to decide. As of today, we have been told that there are pending patients and we should start from today. And we are only going to collect those which government has notified us to collect. We are not still opening to general public because we are not knowing how to service general public, whether to go to home or ask them to come to specific hospitals. All these will evolve during the course of the day or the week. But most important is government has not less than 2,000-3,000 cases pending for testing based upon whatever criteria they have chosen. And our wish is to first fulfill the ones who are waiting with the government for solutions.
Okay. In terms of being able to also offer this in the length and breadth of the country, can you give us a sense of where this will be available? Is it just Mumbai for now?
See, our challenge is even our routine business, blood-based business. We had a turnaround time of 24 hours for metros and 48 hours for smaller towns. But that was under full, perfect and coordinating logistics. Today, the logistics is every state or even every district is clamped down. Specimen movement and they coming to Mumbai is impossible, and I don't think that is something which we would offer and imagine to happen until lockdowns are removed. I am of that opinion that Mumbai and Maharashtra will be served, and Mumbai and Maharashtra has enough of load, and Mumbai and Maharashtra has the highest incidence too. So there are only few laboratories with the limited capacities available. We would be in full capacity in 3 days' time, but we are starting today. Lack of personnel, adequate training for collection personnel, all remains as a challenge. In a normal environment, I would have handled it with all my brain. Today, it is very impossible to use one man's brain because everything is blocked by multiple parameters and factors.
Thank you for joining us, Mr. Velumani. Hope to chat with you again in a few days as we see how this situation develops. We're going to take a very quick break.